Auto sequence start in 5, 4, 3, 2, 1.
Welcome everybody to today's webinar, which is a joint webinar between PAGB and Mediaworks, and the title is Self-Care, Creating Accurate, Informative and Regulated Content for the Right Audience. So welcome everybody today. We are recording this and it will be available as a podcast later, so you'll be able to share with any of your colleagues that miss out on fantastic content that we're going to cover today. So just to introduce who's on the webinar today, I'm Paul Mallett, so I'm managing partner at Mediaworks, and I work across insight and strategy, and have spent a lot of my career working with consumer healthcare organisations, mainly on digital marketing. We've got Gillian Ball. Do you want to introduce yourself, Jill?
Yeah, hi everybody. So I'm Jill Ball. I'm managing partner as well at Mediaworks. So I take a main focus on client services, and we have a lot of clients within sectors such as healthcare. So this is a particular interest for us today.
And last but not least, Fahana Hawthorne. Do you want to introduce yourself, Fahana?
Hi, yep, I'm the Media and Public Affairs Manager at PAGB, and I've been working a lot on self-care since I joined last July.
I'll hand over to Fahana, and Fahana, you can tell us all about the work that you guys have been doing. Yeah, over to you.
I thought it'd be helpful for us to make sure we're all on the same page in terms of what we mean by self-care. So self-care is the actions that individuals take to look after themselves and their family, and to essentially maintain and improve their health or well-being. And in terms of PAGB's kind of focus, often self-care can be described as a continuum. You can see this graph here, and we're mainly focused on the green and blue end of the spectrum. So just to make sure we're all on the same page on what we mean by self-care. So in going forward in what we're doing in 2023, this year, we're currently drafting a new, more comprehensive survey. We're polling over 5,000 UK adults this time, so that's 3,000 more than previous times. The new survey results will be out in 2 reports: a media report, which will be drafted by a journalist and launched in time for Self-Care Day, International Self-Care Day in July, and then a later report which will be more focused for policy and public affairs, so to help with our lobbying efforts, and that will be published during Self-Care Week, which happens in the UK in November. Our self-care survey this year will also look to consider the barriers to self-care. We noticed that in the 2022 survey that there are some things that I'll go on to talk about in more detail, but we need to really understand what is preventing people from accessing and being able to self-care. We also want to know more in terms of where and how people consume healthcare information. Do they do it from their phone, their laptop, on their tablet, and essentially more about digital self-care. One of the things that we've also done at PAGB is that we've developed a digital vision paper, and that's actually just been made available on our website the last 2 weeks. And essentially it brings together all the work that we've done around digital health. And we know that digital health tools are key enablers of self-care. But at the moment, the government's policies have focused particularly on using digital health tools to either look at preventing ill health or providing medical care or managing long-term health conditions, rather than really to support and signpost people for self-care. So the paper focuses on 3 areas where it thinks that if we have targeted action, it could really help improve self-care. And they are online self-care information advice, digital triaging tools, and using digital facilities to allow pharmacists to play a greater role in facilitating self-care. So I just talked to you briefly about these. So online self-care information advice. So as I mentioned, 67% of people said that the NHS should make more information about self-care available online. And we found several good examples of digital self-care information and tools available at the moment. They exist, but the problem is that they aren't easily easy to find. And actually, one of the things that the NHS could do is to signpost to these. So that's something that, you know, we need to consider, and something that PAGB will be pushing for. And then digital triaging tools. We know that GP practices and hospital trusts are using digital symptom checkers and to help triage patients. But what we found was that in the 25 GP practices that we reviewed, only 12 referred or directed patients towards pharmacy care. So it seems as though that the algorithms that sit behind these symptom checkers are often risk averse, and actually they're recommending professional care when self-care would be more appropriate. And that's something that we're also looking at to say that, you know, we need to tweak the algorithms to make sure that they can signpost to self-care. And then pharmacy was the other area. So there are a number of things that changes to pharmacy that could happen that would help people access self-care. So 31% said they would be more likely to go to a pharmacist if they could make direct referrals to other healthcare professionals. And we would hope that that would be done digitally to prevent an additional burden on pharmacists who are obviously very kind of stretched at the moment. Then the other thing is right access. So to allow pharmacists to write on people's medical records, so that this was something that people said would make them more likely to visit their pharmacist, so they know that when they then go to their GP or a specialist, that information, that advice was also available for them to see.
Another thing that is a bit of a perennial question, and I think, you know, when you're talking about digital healthcare, the kind of dominance of the NHS digital services, there was always a thing, we'll just step away from healthcare for a minute, but if you were in the world of food and drink and you were providing recipes, it used to be very annoying that the BBC website used to kind of dominate recipe searches, and you'd sit there going, this is so unfair. Do any of your members, or do you see, I mean, NHS is an amazing institution and it's brilliant, they've got all this content, but they do tend to dominate and occupy a lot of that kind of information gathering. What's your view, or your members' view on that, do you think?
We haven't collected our members' views on this, but we know that there are other tools out there with good health information. That's what we found. And actually, the problem is there is a disconnect between the NHS website and these different health tools. And also, not some of these health tools aren't always signposting back to the NHS. And what we need is something that's a bit more collaborative, a bit more cohesive. And I think that will hopefully then mean that if they're interlinked, people will feel that there's more trust in these sites that they're going to as well. Because I think not just from the world of, you know, commercial companies and brands, but charities that have amazing amounts of great information that, you know, the NHS will never have the means to go into the kind of depth and breadth that other third parties could go to. I think the other one that always comes up is the Mayo Clinic. So American medical information coming up in UK searches, which for a symptom like the common cold, fine. But as soon as you start getting into treatments and things like that, it can get confusing. Does that ever pop up, like, you know, American or European information coming in the UK digital self-care kind of search results? I think that's a great point, and actually that's something that we've not looked at in more detail. But I'm so glad that you raised this, because we're drafting the survey at the moment, so that's something that we can try and understand people's view on that, because you're right, there'll be different names for over-the-counter medicines here.
It gets very confusing, and you know, you'll read a piece of information that says you have to buy this and it costs you an amazing amount of money, but if you're in the UK, there'll be a different option maybe. So I think the first thing, and it's kind of like, if Farhana and her team had got endless time and resources and they could write a 500-page white paper, we kind of thought, well, what would you go into? And I think where it starts to get interesting is where we look at and start unpicking kind of consumer behaviour. And one of the key things that we would look at is how people discover brands. So when we're talking about self-care, but from a commercial and marketing point of view, we're saying, okay, well, how does this behaviour enable us to tap into that in terms of our marketing? So we use a tool called Global Web Index. You can get this kind of data from YouGov. And it allows you to look at very broad audiences or very specific audiences to how they are discovering brands, but also discovering, you can look at particular segments around medical, product discovery. And this would answer the question of the person that asked about, older people and that kind of thing, but because you'd be able to get a read on this. But what we see time and time again is the number one way that people discover brands nowadays is through search. Second is kind of word of mouth. Third would be still seeing things on TV or on video, and then getting into things like social media and social influencers, that kind of thing. But search is really, really important. It always has been. And I think the other thing with search is it can give us such interesting insights into seasonal patterns, how different trends, how different macro factors are kind of impacting on what people are looking for.
Definitely would recommend, gathering as much search data as you can, definitely looking into things like social listening, and then analysing that and coming up with really ownable content territories that you can then build out your individual sort of search, social and web foundations from. If we talked a lot about allergies there, if we take something like that, some of those content territories could be things like triggers or symptoms, or even through to things like coping strategies or more sort of factual information about medication. Because I think if we start with that, if we start with the search data, we start with the social data, clearly there's a big appetite. We can see that in the data, but also then we're really tapping into a lot of the audience need states that we can see out there and the kind of the ways that people are behaving. So that's the sort of first step, gather lots of data, and then really it's about then identifying what are your content pillars going to be, making sure that you're quantifying that through that data. What are the volumes of searches, the kind of social conversations that are going on, and then you can ultimately get into the detail of your different strategies and plans. Let's
talk about the delivery, and then we might loop back to the kind of specifics of the question.
Yeah, I think, there's different things that you can do. I think, if we were looking at the probably sort of building from base up, it's certainly starting to look at creating articles. So, a certain number of articles every month, and, appreciate that's kind of resource and budget dependent. We've got to make sure that those web articles are engaging, but also that there's kind of input there around the SEO side. So making sure that those are fully SEO optimized as well, and that we're really matching the interest that we're seeing out there from consumer searches and interest. So yeah, certainly articles and sort of tapping into sort of SEO. I think other things that we can do is, we've developed social publishing plans, and, a lot of that is identifying, well, what posts are we going to create, but aligning that with those content territories that you've laid out in your content strategy. Publishing content, I think certainly looking at the sort of impact of building communities, and brands can play a big role in that in terms of the content that they're publishing, but also for consumers to, be sort of in communities with like-minded people that are going through the same issues. I think they ultimately sort of seek comfort in others, and like you say, there's a lot of sharing out there of how people are helping sort of deal with those issues. So yeah, it could be the medication, but there might be other ways that they're coping. So yeah, I think sort of search, social, that's a big priority. And, I think that given that we get all of that correct, I mean, we've got to make sure that we've got the frequency correct, that, that we're getting the right reach for that content. And also, making sure that you're looking at the paid support there as well, particularly in channels like social. But ultimately, the combination of those two things, search and social, is where you're going to see that improvement on your brand performance.
And I guess then that so it is relatively straightforward. It does take time and investment and organisation to once you've worked out what you're going to publish, to actually publish it, to take the time to SEO it, to put kind of content outreach, digital PR behind it, investment in social, growing communities, and I think that sometimes that can be off-putting for people because they think that this is it's a lot of effort for something that is now. Does it have an ongoing benefit that once you take a longer view?
Yeah, I mean, I would agree. It is a big commitment, and it's always on, and it's not a short-term campaign burst. It's a long-term commitment to the resource that you're investing. So clearly, we've got to build a case for businesses to make sure that they're seeing the return on that. So again, I think there's studies. So if we go back to IPA, there was one that they did with Kantar, that there is absolutely a strong correlation between share of search and share of market. So where your share of search on average represents 83% of your share of market. So I think that just kind of reinforces the impact that you can have in this area if you invest in it, but appreciate it is a big commitment.
Someone's asked about will platforms short form video be used by PAGB or the NHS? Okay, so PAGB don't, they're a kind of body regulator, but the NHS certainly use the full range of social media channels to promote self-care. We're doing a project at the moment with a very large NHS trust in London, and a key part of it is how they're engaging with their kind of audiences through social channels. So it's not every NHS trust will have the same amount of content publishing. You'll find an immense amount of stuff out there, and this is again is a reason not to think of the NHS as a big monolith. It's like the NHS website is its thing. NHS trusts have got their own remits to produce content and to help people, and as a brand, there are many opportunities that you can be there and be part of it. I think Jill's point, like the example for allergies, where and I spoke to it as well, that there's the triggers for allergies, there's the symptoms for allergies. Well, that sounds very much like NHS territory, but coping strategies, that is less likely to be there on the NHS website, and sometimes the consumer will that maybe that entry point into really starting to understand and resolve their allergy could be through understanding coping strategies that then could lead on. So it's never a done deal when it comes to looking at who's owning the content space.